Good evening, good afternoon, and good morning. This is the 1805th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, we have a discussion on the problem faced by students of homeopathy. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have the local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that you can subscribe the same without paying any money. You can share it with your friends, and the purpose of this forum is to take homeopathy to every home around the world. As you all know, we are nearing the 5th anniversary that is to be conducted on September 28th at Taj Hotel at Cochin. We invite all of you to register for the same so that we can meet one to one another, and we can discuss about homeopathy, futuristic homeopathy, and there will be some presentations, and there will be some discussions, and there will be some cultural activities at the end of the session. So hope all of you will register the same. The registration fee is rupees 3,000 per head. As you know, it is a big hotel. It's a 5-star hotel, so that's the reason why the rate is so high. Hope all of you will register. We are getting some of the international faculties also joining the session. So let me come to today's session. As you all know, today we have a panel discussion on problem facing the students of homeopathy. We have the panel members, Dr. Roy James. He has completed MBBS DGO, and now he's a BHMS student at Trivandrum Homeopathic Medical College, and he's the junior consultant in obstetrics and in Kerala Health Services. The second person is Dr. Subhashish Mukherjee from Kolkata, and third is Dr. Kanchan Pradeep from New Delhi, and Dr. Pallavi Chaturvedi Jaina from Maharashtra, and Dr. Abhishek Singh. So we invite all of you to proceed your sessions. First, we can have a 10 minutes presentation. Then we can have a last 2 minutes each for discussion, and then we can make the final assessment. So I am inviting Dr. Kanchan to begin the session. Kanchan Reddy, she is a gold medalist also.
Dr. Dhanesh,
Yes,
all the panelists needs to be made co-host. They are present.
Yes, sir. Yes, sir. Yes, sir. I'm trying to make it, sir. Sahani sir can say a few words just before the session.
Just I have finished the spirituality.
Okay.
Welcome all the students, participants, and you are the future of homeopathy. To the students, I only say that you are the future of homeopathy, what we have done and what you expect from homeopathy. This is very much important for all of us, for the next generation homeopathy. And taking homeopathy to the next generation is very important. So we would like to know about your problem and what solutions you suggest. That each of you participating here must try to delve on the what you want to suggest to the we as a guardian or other as a and at the institutional, wherever you are facing problem, and what is the requirement that you need. So I will not take too much time because times are very limited. So Kanchan, you can start your presentations now.
Thank you so much, sir. Good evening, everyone. And thank you so much for inviting me here. And this platform is now very close to my heart because we keep on exchanging our ideas, perspectives, insights over here. And they are very meaningful to me and to everyone who has joined. So today's yes. So Today's discussion is about the problems faced by students of homeopathy. So it's very clear that, as Sahani sir said, students are the future. These BHMS students are the future doctors. So definitely they are the foundation. So being a student is the foundation of a pyramid. So when we talk about the problems of students, so I think these problems should be resolved at this level of being a student, and these problems should not go further to make the pyramid and should not multiply with each step. Like after a student, the student goes to clinical practice, then professor, lecturer, and more. So these problems should be resolved at the student level only. So what I think, one of the major problem what I have seen during my BHMS course also, that there is lack of clinical exposure. Like the students keep on working on their theoretical part throughout, like for 3 or 3.5 years, without any real contact with the patients or the real touch to the patients. So what's important is I think the institutions should start the clinical practice or the clinical classes from second year onwards. It is very important. Although in some institutions, some colleges, it has already started, but still there are some colleges which lack to grow in this perspective. So it is very important for them, because by the time the students reach their internship, by the time they enter internship, they are all lost between the exams and the real practice. This is very important. They don't know how to approach a patient, how to start the case taking, how to prescribe the medicine, because they are so underconfident. So, to uplift their confidence, it is very important that the clinical classes should be started earlier, before third year. At least how to take a case, how to prescribe a medicine, and what is taken into consideration before prescribing should be clear to them before entering the internship or before starting the clinical. Moreover, I would say that there is one more thing which I have observed: limited integration of the diagnostic tools. It is all yes, that is all related to the students have limited exposure to the x-rays, the imagings like CT scan, MRI, ultrasound reports, and the lab diagnostics as well. So many of the students, they get lost when they start with the clinical cases. When they see that, okay, so if some patient comes with some reports, they don't know how to start, how to say if the leukocytes are increased, if there is some problem in the ultrasound findings. They don't know how to analyze the report. So it is very important to give them more and more exposure towards the diagnostic tools. So this interpretation should be easy for them. And this is also important in the clinical practice when they come out of the internship and they start the clinical practice. And when we talk about the clinical practice, I would like to mention here that it is very, very important for the students. They should also emphasize on one thing, that we all know not everyone can start the clinic just after internship. Some students lag because of financial conditions. So the teachers, the professors, and the mentors, the mentee, the seniors, everyone should do one thing. They should teach the students. They should be taught, the students should be taught how to take the online consultations as well. It's not about just setting up a clinic, how to set up a clinic. No, not every student has such financial condition to do that. So they should be taught how to do the online consultation, how to do the medical writing. This is very important, and I really wanted to take this into consideration and into no in view of everyone here. One more thing which I have observed is the lack of knowledge about research methodology. Because I think that if the students are the futures of homeopathy, if we are the future of homeopathy, then everyone should know how the research should start and how it should further propagate. So I think this should be taught in the colleges as well. From the very second or third year onwards, it should be taught to them how to write the research papers, how to write the review articles, how to read the papers. Because first we know that while starting anything, any research paper, we have to read at least 100, 200 papers, and then we have to take out the data and then review it and then write a systematic review. So for that, the students should know how to make the analysis, the meta-analysis and everything. But the students are clueless. They don't know how to write a paper and what the research paper means in homeopathy or in medical science and what benefits it will give them. Because it is very important in future, the research papers, the more research papers you have, we all know that it will add to your curriculum vitae. So that is very important. So they should be taught about the cohort studies, about the how to analyze the RCTs, how to do what is the methodology, what how to publish the paper. For this, I think there can be a solution. The students should be mentored. They should be taught about this, and the colleges can organize competitions like poster presentation competitions, short paper presentation competition, so that by the time the students get into internship, once they enter the internship, they can start doing the documentation of their cases. Whatever case they treat, they can start making the documentation, and by the time they pass out, they have that much of confidence to publish their papers, either under the guidance of a doctor, their professors, or their individual. They should know at least the procedure should be known to them, how to approach. This is very important. Next, I think motivation, mentorship is very important, and we all have seen that the medical colleges, homeopathic colleges lack in this, and I've seen it in my college also. This should be encouraged more and more. The students should be given the right direction. They should have a good peer support groups, I would say, so that they can get more confidence about how to grow more in this field. Because they get demotivated even if a patient asks what will be the validity of the homeopathic medicine, how much time will it take to cure their disease. So this demotivates the student at time, because they say the homeopathy acts very slowly. So this really demotivates the students. So for this, I think uh, the teachers, the professors should really make them confident about this thing, how to answer the patients, how to tackle with such problems, because it's not about the academic, but it's also about their mental health struggles. So these should be discussed side by side with the students, and the guidance, career guidance is very important for that.
Okay.
Also, yes.
Okay, Doctor. We have 10 minutes to be given to all, and then
Yes,
thereafter,
yes, yes, sure.
shall I conclude here? Yes.
Uh, yes, I just want to add one thing only, that what I think that the teachers and colleges should either invite, or if not invite, they should give the examples, share the success stories of the young homeopaths who have just passed out. Because about the we all know about these homeopaths who have already succeeded after their 20, 30 years of practice. But they should invite the young homeopaths so that the students can easily relate with them. So it is very important. And yeah, we
Thank
can
you.
conclude here. Yes.
Yes, definitely. Your suggestions are really excellent, and hope we can have final conclusion at the end. Now I invite another second generation homeopathic doctor student. He is none other than Dr. Roy K. James. Doctor is the son of a homeopathic doctor. That is, she was working as she has retired from government service as a principal of a homeopathic medical college. And Dr. Roy Thomas has completed his DGO, and now he is studying homeopathy. So this shows his intense interest in homeopathy, or intense love for homeopathy. So I invited Dr. Roy K. James to this session.
So thank you, sir, and good evening all. So I am Dr. Roy K. James from Kerala. So I am had completed my MBBS from Assam, Johor Medical College, and PG in Gynecology, DGO, from Government Medical College, Thiruvananthapuram, Kerala. And right now I am pursuing BHMS in Government Homeopathic Medical College, Kozhikode. So I was working as a junior consultant in government health service in Palakkad, and I have taken a long leave to pursue this course. So regarding the problems faced by the students of homeopathy, it's like there are innumerable number of problems, but I would like to throw light on the most significant ones. So the first and foremost is the lack of confidence. So this lack of confidence, it emanates right from the process of admission to this BHMS course. So this is the scenario in India where BHMS is taken by, pursued by the UG students right after their +1 and +2 classes. They write an entrance course. So this is the scenario in India. So here homeopathy, the BHMS, it's ranked second or third to the mainstream allopathic medicine. So this lack of confidence, it starts right from there. So it's like they doesn't get into a well-known college of allopathy, or they doesn't get admission to this MBBS course even in private hospitals, and then their next thought is that they need this medical science. They want to get an admission to the course on medical science, so they will get into Ayurveda or homeopathy, either of these. So that becomes their second or third choice, just because they can't get admission to an allopathic college of medicine or the modern medicine. So this lack of confidence, it starts right from there. So once they get this admission and they pursue this course, it's like it's always there in the back of their mind. This is a second grade or third grade medical stream compared to MBBS. So they needn't put too much effort, or they this wholehearted effort from their side, it never comes up. It's always like yeah, they are into some medical field, and they want to establish this idea among their relatives and friends. I'm not talking about all, but the vast majority, they have this kind of idea, and they take on this course. So gradually what happens is that later on, as they pursue this medicine, these studies, they doesn't put too much of effort, either in learning the subject or understanding the subject. And our homeopathy, it's like a holistic, it has got a more holistic view of the human body. And only if you have your all senses opened and your whole heart put into the system of medicine, only then they can actually learn and understand this whole system of medicine. It's a most sacred and most sophisticated system of medicine as far as I have perceived it, because allopathy or the modern medicine is very easy to tackle or very easy to study and practice. There are always a fixed remedy or a fixed drug, a drug of choice for every other disease. They have a set of protocols, just like the engineering student has got a methodology in practicing or in doing things. They have a standard operating procedure in everything. Just like even if it's a simple fever, if it's a dengue fever or any kind of fever, they just name it and they have a definite protocol for each and every other disease. But in homeopathy, it's not like that. You need to have an abstract view of the mind and the body of the patient to understand the patient in the whole as a whole, and then only you can prescribe the right simillimum. So this lack of confidence, it paves way into a more casual way of learning this whole system. And this continues until they reach their internship. They'll just keep learning things, and they just learn things for passing out their exams, and they keep learning until and unless they pass this exam, they can't move forward each year. So they just keep learning things by heart, most of them, not all. Again, I'm stressing this point, not all. Okay. Most of them, they keep learning things by heart, and they just, even if they are exposed to these various cases in the clinics, they just keep by hearting these remedies. So and so remedies for this kind of condition, and so remedies for this other condition. So they keep by hearting things. And only once they reach their internship, they are really exposed, or they just are put into demand of learning this whole system much deeper and thoroughly, and only then they come back to their senses that they have learned nothing. And in their internship, they struggle like anything. That doesn't get enough time even to study or to practice. And finally, once they are passed out of the college, most of them, they struggle like anything. So this is what happens in reality. So this lack of confidence has to be tackled right from the beginning of the admission to the course. Mm. And the next thing is that the lack of proper guidance. Mm. And this part has to be dealt with both, from both the student side as well as the teacher's side. The students, they have to be well versed in English language, because our homeopathic textbooks, they all are written in well mannered English. In the old literature, it's very difficult to understand it until and unless you have got a very good vocabulary or very good say in the English language. Mm. So until and unless you develop a taste for the language, it's very difficult to grasp these things. Mm. And finally, from the teacher's side, it's like the students, they have to put a lot of effort in learning these things. It's like I would say, compared to an MBBS student, a BHMS student has to put a 3 to 4 times an effort mm, to learn and understand the subject. Only then he or she can come up as a good homeopathic physician. This hard work, this genuineness at heart is mandatory to practice the system successfully. So they have to be very much observant in their curriculum, even in their studies, as well as in the clinical practice. Now, from the teacher's side or the professor's side, it's like they have to give proper guidance to the students. When even when they are in the theory classes or in the clinics, the teacher or the professor has to guide them properly, that why they have prescribed so and so simillimum for a particular patient or for a particular condition, whether it be an acute or a chronic case. And next thing is that the cardinal principles of homeopathy, it has to be observed very cleanly, very clearly, everywhere, in theory and in practice. If these cardinal principles are not observed, it's very difficult, or uh, it's very difficult to get a proper cure in every case, whether it be an acute or a chronic case. It has to be it has to be managed by the cardinal principles of homeopathy, irrespective of the similima that you select. Mm. And again, this poses a problem, because everywhere, even after the students they pass out, even if they are first working under mentor in a private or a government clinic, it so happens that everywhere or in most places, the practitioners, they practice homeopathy according to their whims and fancies. And what happens is that these cardinal principles of homeopathy are given little regard, which had to be the cornerstone of the clinical practice. And the freshly passed out student, they stay confused. They stay confused as to what to follow, what whether they always remain baffled whether that these things mentioned in the textbooks, whether it is true, or that they see in the clinical practice that is true, because everywhere they see practitioners practicing in different ways. But truth is always one. And that's what been mentioned in our textbooks by our stalwarts, by our master Hanuman. And that stays the truth, and truth of homeopathy, to be precise. And until and unless this is followed everywhere from the theory classes, in the clinics, in the clinical practice, this truth of homeopathy has to be upheld as the most important cornerstone of practice. That is, the cardinal principles of homeopathy has to be followed, and it happens seldom. So this is another pitfall for the students, that they stay confused. Even if they are getting ample exposure to these clinical cases, they stay confused. And everywhere they can see these freshly passed out students, and they will see that these cases, many cases are cured by other ways other than those practices that boast of deviating from the cardinal principles of homeopathy, of prescribing multiple remedies, of prescribing, even if they are prescribing single remedies, but more frequent irrational repetitions of medicines. They say that they have got the result, but mostly it will be just a palliation of cure. And it won't be cure, it will be just a palliation of the case. In most of these cases I have seen, especially in skin complaints and all, I can see many practitioners saying that they have got cure in the skin troubles by practicing multiple remedies at a time, at a single time, or
Well,
medicines frequently. And their students, they just get astonished by, oh, so even if you practice out of these cardinal principles, you can get the results. And they again stay confused, and they try to practice in their way. So what
well,
happens is that this is just palliation and not cure of the disease.
okay, Dr. Roy James. We can please continue. Please wait. We can have discussion in the last part if we get time. Okay.
Sure, sure,
Excellent.
sure.
Your views are entirely different, and it's really appreciable that you are really giving guidance how to study homeopathy and how important the confidence in a person. Yes. And now let us go back to Dr. Pallavi Chaturvedi, and
Thank you.
Doctor
Yeah.
is from Jalna, Maharashtra. Yes, it's over to Dr. Pallavi. You can unmute yourself. Please unmute. Please unmute
She's not
yourself.
from Jalna, she's from Mumbai.
I'm
Okay.
from Mumbai.
Okay. Okay. Sorry for the mistake.
Dr. Dhanesh, you
No
make
problem,
her to
sir.
come from Jalna.
Okay, sir. That's
Earlier she was in Jalna, but right now it is in Mumbai.
okay, sir.
Thank you, Sani sir, for giving me this platform. So I'm residing in Mumbai since I was born, and I have been practicing homeopathy for last 18 years in Kandivali in Mumbai. And I did my master's from Guru Mishri College in Jalna. So I really appreciate the points given by Dr. Kanchan and Dr. Roy, and I agree to all those points. And in addition, what I feel from where Dr. Roy started from the time of admission, I feel the whole system of taking admission in homeopathy should be dissolved, because I feel that homeopathy is much, much superior to all other medical sciences, where the gradations are given and importance is given to the marks that CET gets, and then homeopathy comes lower down. That whole system is itself, I disagree to the system that a student who's less capable will get homeopathy. No, this idea should be dissolved completely. So whoever passes 12th, let colleges have open entrance exams, and people who are really willing to do homeopathy, I think homeopathy first should be promoted amongst the masses. We should have good colleges with good faculties and good setup, so that you can actually promote the colleges and impress people that yes, homeopathic college can be so vibrant, and the teachings and the exposure is so much, it should reach to the masses that yes, homeopathic colleges are really very beautiful, where the students who come out are impressive and they are doing good practice. So I think the current scenario where a lot of young practitioners are doing very good homeopathy. I'm from HHF, Hahnemannian Homeo Forum. So we are training students and young practitioners, and with very good results, they are coming out brighter. So I feel the whole scenario of promoting homeopathy should first come up. And the CET thing is just adding on to corruption and nothing else. That is what my frank review is. And Secondly, after entering into the college, the first thing, and after passing out, the first thing that we need to do is repertorize the case. So I feel software exposure to homeopathic repertory should be given to the students right from second year onwards. Let the theory part be done, but then that theory is not adding much value in our practice. I think software repertory should be introduced in colleges itself, where students are trained to repertorize the cases the way they want, because there are so many varieties of repertory. So after the students pass out, they are at a loss to understand which repertory to use and how to use. So I think that IT knowledge is very, very essential for homeopaths. Homeopaths are all rounders. They need to understand psychology, IT also, software technology information is so very important to us. The English background that he said, English language, because if we have the software in our hand, I think English will gradually improve on its own. And there is a lot of this is the next point, the third point I'm saying, that there is a lot of discrepancy in colleges which are in urban areas and which are in rural areas. So the condition of colleges, the kind of exposure students get in rural colleges is very, very bad and poor to the level of what students get exposure. At least in urban colleges, there is better exposure. But yes, there are certain things missing out, like first aid confidence, in first aid, especially when we had a situation like lockdown, where very few doctors had opened their clinic and very few places for patients to go. So homeopaths are not, they don't have the confidence to deal with first aid situations. So I think in the colleges itself, if we have, suturing pad available to them, if we have that clinical knowledge, like how Dr. Kanchan also mentioned, of seeing the X-ray, CT scan, MRI reports, ठीक है, वो conclude करके दे देते हैं, the investigation pathology labs, they give the conclusion. But at least if something like ECG analysis also, in practical way, if we know how to read an ECG report, so that is something clinically where they should be attuned and they should be empowered. And even in Gynac, see, I had written all the subjects that we have. So toxicology, death certificate, these are the practical things that homeopaths should know by the time they pass out. Ki death certificate how to make, a fitness certificate how to make. And then coming to the repertory part is over. Gynaecobs, there is a good exposure, but still how to deliver practically. If we have done one delivery at least during our whole tenure, so or assisted a delivery, so that also makes sense. If there is some situation like in flights or in trains, people ask that if there is a doctor, you please let us know. So how to do CPR, how to do a delivery. Kabhi aisa situation, if there is some emergency situation, we call ourselves doctors. So but then we are not confident enough to do certain things, certain procedures. So I think that level of exposure should be there, that level of assistance should be provided to all the homeopaths. And then the seminar part that I was talking to Dr. Sani in my last lecture, that if the homeopaths are exposed to good seminars, to good mentors who are coming regularly to their college, may they be of all systems of homeopathy. Let the students get exposure to all systems of homeopathy, whether it is Vijayakar, Shankaran, HHF, Applied Mind, jo bhi hai, whatever it is, they should be exposed, and they should get training, clinical training with all the system of doctors in their internship. If there is no good exposure at the college level, they should let them go and give them the freedom to come back with proofs that they have attended certain clinics, the physicians, homeopathic physicians who are doing well in their practice. That exposure they should get, otherwise they will not be confident. The lack of confidence comes from not seeing results during their tenure of BHMS. If they see results, whether they are the OPDs of the colleges itself, from the professors, or whether they are attending clinics of other doctors who are doing well in their practice. So if suppose I have done my MD from Jalna, so at least Jalna students can go up to Nanded, they can go to Aurangabad, they can attend different clinics. Then different mentors should be invited to the college, and they should be provided by their traveling allowance and their taking lectures also. Something minimum they should be provided to the, something minimum if it goes into the hands of the speakers also. So it gives them an encouragement to come and really teach from their heart. So some reciprocation should be there. So basically a financial aid to colleges, or if colleges lack that, I don't think colleges lack that, because the fees is so huge, and the kind of quality of teaching that goes in rural colleges, it is not appropriate to the way they are demanding. I know donations are there and other things are there. So at the level of corruption and fees is also something that is mind boggling, and that is why the students, they lose their interest in practicing homeopathy, because they just feel the education is all about corruption and nothing else. So if they get the quality education and exposure, I think their mindset will change, and that negativity will go down, and they will get boosted to actually come out and practice homeopathy. Because if you see the students ratio who come out and practice homeopathy during my time when I did my BHMS, we were 105 students who passed out BHMS in my batch, and out of that only 4 of us actually practiced homeopathy, and rest all went into different fields, like doing allopathy, GP practice, or working for some pharma company or some IT company, and insurance companies. So this is the ratio. So, and even today the ratio has not changed much, but yes, the revolution has started as we all are sitting here and discussing this issue of what needs to change at the level of students of homeopathy. So I think from start to end, this if all this is also taken care of, much will be improved, and the
Yes.
scenario.
Yes,
Thank you so
definitely.
much.
Definitely, Dr. Pallavi Chaturvedi,
Yes.
what you have suggested excellent things for the promotion of homeopathy. And that's what the purpose of International Forum for Promoting Homeopathy. Please continue. Now I'm inviting Dr. Shibashish Mukherjee to say his opinion on this.
Good evening, everyone, and a special thank to Dr. Shahani and Dr. Dhanesh for giving me this opportunity. So my previous speakers, Dr. Kanchan, James, Dr. Pallavi has already highlighted most of the things which I would have liked to highlight. So what came out of it, that there is lots and lots of confusion. So let me be to the point that there is lots of confusion, like what is to be done. This school, that school, some doctors practice this, some doctors practice this. Some colleges in OPD use different doctors practicing in a different way. And if we refer to our books, each say it should be based on some simple, easy easily comprehensible principle. But the thing as if they're practicing according to whims. It's another question whether this should be a single remedy or that is a polypharmacy should be there, whether with a medicine one should include mother tincture, biochemics or not, whatever is the maybe the question, whatever may be the truth. But the first confusion arises, what is to be done? So the student should see or at least be exposed to some uniform things. And this should be practiced all across the country. They should also know this or see their seniors or the others doing the same. At least we may try to have a uniformity in the college level at least. We can't force the individual practitioners. Now in the college, another thing that we lack confidence. The students, they do lack confidence because most of the colleges, leaving a few, do not give the student the exposure of emergency management and emergency suture, how to give CPS, and all these things. So the first thing what they see, whenever such things comes, we should refer to allopathy. For simple sutures, a cut, we forget the use of simple remedies like calendula, which is, if I'm not wrong, is far better than most of the conventional allopathic medicines. At least my experience says so. You are ready to differ, you may differ, but what happens that the students, the newcomer, do not get exposure to these kind of things. There remains a fact that the students, one of the approach that Dr. James highlighted, the students have a tendency to mug things up. So that's a huge problem. So let's talk in our subject. Another thing Dr. James highlighted, editions, newer writings where we have the contemporary English. Say for organelle of medicine, I know it's going to be a big debate. We know that the dozen and translation is very, very much authentic. But we do have a better translations, like easier translation, which are almost equivalent to that. Like say for Dr. Kunjli's, we can, okay, if a student get initial approach to these translations, then we may introduce a dozen's translation as a supplement to that. This time, I think they, if they are comfortable with a new idea, because I think the homeopathic idea till +2, what we learn is the idea of the modern medicines or the outlook of the so called modern practice, modern medicines, the idea of this. So suddenly we are learning about the similia. Seems like we are falling from heaven. So let's give them a bit comfort if we can give them such kind of an idea. So I think a language problem we could solve. Another highlight which Dr. Kanchan highlighted is the integration of research methodology. As per the recent moves by NCH, research methodology have been emphasized with community medicines, and STSC is going on. But what needs to be done is this: all the research, whatever is going on, is not been integrated in our text. We learn what have been going on for 100 or 150-year-old ideas, which may be true, but with time we have learned new things. Our concept, our modern medicine concept has evolved a lot, but none of the research is reflected in our homeopathic subjects. So integrating them could again give us more confidence that yes, our research is showing these things, so we may do such things. We can update our Metra Medica with this research. We may bridge those gaps. So this is again going to help us if we can integrate all those things. Another thing which we do is we integrate or try to add Metra Medica to allied subject as therapeutics. When we study these allied parts, what we do, we miss on the management part because it's mostly based on allopathic part. And integrating therapeutic in this, there remains a gap. But we can do in another, in an opposite way. Why don't we integrate some part of allied into our Metra Medica? You are having these collections of symptoms. Just add a note that this could be this kind of a symptom or this kind of a malady. A reverse way, that is integrating a both way. So they can revise and revise and have an easier time over there. So I think if we can do such changes, already other things we have been highlighted by the other speakers, and we are running short of time. So I won't be dragging much. So let other speakers have their time, and then if time permits, we can continue further.
Yes, thank you, Dr. Abhishek. Thank you, Dr. Shibashish Mukherjee. As you rightly pointed out, we need to look into all those aspects where students facing crisis, and we need to bring them more best doctors by giving a good education, good exposure, and everything. So now I am inviting Mr. Abhishek Singh. He's a student of homeopathy to this session. Yes, you can talk now.
Good evening, everyone. Respected doctors and my fellow students. Basically, I'm Abhishek Singh, a second year BHMS student at Nehru Homeopathic Medical College, Delhi. So, first of all, I would like to thank Dr. M.K. Sahani sir for giving me this opportunity. So, as my fellow panelists have already shared some important concerns, I would like to add a few more thoughts from a student's everyday experience, things that often go unnoticed but matter deeply. So let me begin with something many students silently carry, that is low confidence and career related uncertainties. Like many of us join BHMS after several NEET attempts, already carrying a little burden of low confidence, thinking maybe we are not good enough while we are still trying to find our place. Career related uncertainties added to the pressure. Like we all know that government jobs are very few, homeopathy departments in hospitals are rare, and the private sector hasn't grown enough yet. Starting a clinic may sound perfect, but it needs money, guidance, and trust from the community. Things that are not easy to get, especially for the first generation medical student like us. And then there is a different challenge altogether, the misconception. So basically, a simple internet search can throw up all kind of half-truths and doubts about homeopathy. People ask, does homeopathy even work? For us, this is more than just a question. It basically touches our identity as a future doctors. We also hear remarks like, oh, BHMS, so you didn't get MBBS. And one of my personal favorite is, so you people just give sugar pills. So these are not harmless jokes. They are misconception that over time can shake our confidence, combining our personal doubts with society lack of understanding. So beyond confidence, there is also a learning gap we can't ignore. That is a difficulty in relating materia medica with modern clinical practice. Like as a student of homeopathy, as a second year student, one of the most common challenge we face is that we study materia medica extensively, like from different books, from Kant, from different books. But we are not taught how to relate those symptoms to modern diagnosis, pathology, or clinical medicine. And most of the diseases mentioned in our classical books are written with old names like dropsy, phthisis, ague, rheumatism. But in today's clinical setting, when a patient came to us, we deal with terms like congestive heart failure, pulmonary tuberculosis, malaria, and autoimmune arthritis. So we often don't understand how do I match what's written in MM with what I am seeing in the patient or in their lab reports. Another big difficulty is understanding the concept of constitution. We understand that it is central to our approach, but as a student still learning about diseases, we sometimes struggle with how to apply that concept practically. Also, in today's time, modern tools like radiology, pathology, or evidence-based protocols are playing a big role in healthcare, like as mentioned by my senior Kanchan Upriti ma'am. But we rarely get any formal training on how to combine our homeopathic approach with these tools. We don't know how to interpret a CT scan or an MRI in a way that helps our prescription, or how to use lab findings alongside the totality of symptoms. So somewhere we are stuck. We study deep holistic symptoms in materia medica, and we also learn about disease and organs in other subjects, but no one really teaches how to connect these two worlds. If this gap could be filled, I believe our confidence as a student and a future practitioner would grow tremendously. We could become homeopaths who understand both the art and the science, who are grounded in philosophy, but also fluent in modern clinical reasoning. Even if we learn well, the next challenge is how to make it work in a real life. Okay, like a lot of people say, ki open your own clinic, start clinical practice, you do well. And yes, many of us want to, but no one really tell us how to make that practice financially sustainable, especially if we are committed to classical monopharmacy. We look around and see people earning well with polypharmacy and using different techniques, and they are doing financially, and they're doing great financially, basically. So, but when it comes to classical symptom-based single remedy practice, the kind we are taught to follow, there is a very little guidance on how to make it work as a career. I know there is a passion, but there is also a confusion. We are not questioning other approaches, but we are asking, if monopharmacy is the foundation we are taught, then why is no one showing us how to build a successful practice around it, both clinically and financially? Because at the end of the day, we do not just want to serve, we also need to survive. So I think that with the right mentorship, case discussion, and exposure to the real world examples, we could learn how to practice ethically, classically, and still make a living. And that clarity would go a long way in shaping confident and independent homeopaths. So, and then comes the basic or backbone of every medical science, that is the research. So I know this topic is already been covered, but I have some more points to add on it. So research is the backbone of science, as we all know. It proves and strengthens what we practice. But in homeopathy, we are often missing from this important space. Most homeopathy colleges don't have proper research department. Student research grants are rare, mentorship is weak, and publishing in peer-reviewed journals is almost impossible. We are hardly taught how to write research papers, analyze data, or do clinical trials. Because of this, many valuable clinical experience remain in our casebooks, unseen and unrecognized by the scientific world. In many colleges, even basic facilities like ethics committee or access to online journals are not available. Like, if we want the world to recognize the strength of homeopathy, we must back our work with data, transparency, and scientific standards. This has to start early by training and guiding students in research during their undergraduate years. We also need to think about why we are not doing research in a ways that reflect how homeopathy truly works. We all know it is not just placebo. We know from that practice. Now it's time to prove it with evidence. Now, but none of this will change unless our voices are heard. So we need a student representation and unified voice. One of the biggest gap we face as a homeopathy student is the absence of strong collective voices. In other medical system, we see like bodies, Indian Medical Association, actively represent doctors, safeguard their interest, and challenge any move that undermine their profession. But in homeopathy, we lack a powerful unified council to stand up for us, to raise our concerns, protect our dignity, and question policies that may be unfair, unscientific, or dismissive for our system. What we truly need is a student council or representative forum, not just for cultural events, but for real advocacy. A platform that bridges the gap between policymakers and students, ensuring that the future of our profession is shaped with our voices in the room. Because if we don't speak for homeopathy, then who will? Thank you everyone for listening me.
Thank you, Mr. Abhishek Singh. It's really a worthwhile session from you. We hope that this kind of young generation students as well as doctors are the real uh, uh, for followers of Dr. Hahnemann in the coming days, because you people can definitely take homeopathy to the #1 stage of this whole world. That's what our aim. That's the reason why the International Forum for Promoting Homeopathy is doing all these things. We have already uploaded more than 4,000 videos in YouTube. So all those presentations were just like evidence-based homeopathy. And you can consider these things as evidences, as the best research papers. So this is what homeopathy can do for homeopaths can do for the next generation doctors. Definitely, we will conduct this kind of sessions regularly, so that you people can come out here and you can share your thoughts, and you can add something more to take homeopathy to higher level. It is the time for conclusion time. So I am giving 2 minutes time each to the participants once again for your conclusion remarks. It's up to Dr. Kanjan Utpati.
Yes, sir. I have heard everyone, and I really agree with each one of them, all my co-panelists, and they were very true in their regard, whatever they have said. I really agree with them. And after concluding the whole thing, the whole session, I have just want to conclude it like it really makes a sense that at the end, if we say after this whole session, if we say that we really need the in-person communication and the connection between student and the people who are concurring in this field, like if we say the young homeopaths or the homeopaths who have already concurred to a level, if students get to communicate with them in person, they get a chance to ask their questions one on one, then it will be very beneficial for the students, and it is really needed that the students get in touch with this such kind of professionals. So it will be very helpful for them. So I think not only just the no, we are just giving our perspectives and their insights, but it should be implemented as well. Because unless it is not implemented, it is not worth it to talk about more and more. So it's just that I want to conclude it here only. But I think there will be some action regarding the same, and we will implement this to our
Definitely, we will try for that. We will try to connect you people with the highest authority of homeopathy.
because we are ready to give our knowledge. We are ready to
Yes,
motivate the
yes.
students and tell them how to grow. We just need a platform to help them.
Definitely, you people can bring more students to this forum so that we can give guidance and everything to them. And now it's up to Dr. Roy James.
Yes, as I had pointed out earlier, there are a lot of issues that been burgeoning the homeopathic system of medicine, and I just had started. And 10 minutes it seems too short, very short, to address at least the most significant ones. I just had started with the most significant ones. So
Definitely, we can have 1 hour session from you if you are ready.
yeah, sure, sir, sure, sir. In future, we can plan about it. Definitely. And what I had stated that even after I being a well-settled allopathic doctor in modern medicine, I had a government job where I have taken the long leave from. I had chosen homeopathy just because of the effectiveness of the cure it can give their patrons and patients. And it's very effective that none other system of medicine can compete with homeopathy in terms of medicinal care that it can offer. Of course, in adynamic cases like fracture, burns, and all, of course, you would need and lacerations, you would need some allopathic assistance where the mechanical repair also has to be done. But medicinal wise, homeopathy stays on top of all other systems, and it's the future of medicine. So it's very imperative that we safeguard this system of medicine in its purity, in its pristine form, so that the future generations can reward from its existence. So I hope I can elaborate more, but because of lack of time, I have to
Yes,
refrain
yes.
my question.
We are waiting for a big day from you for a session,
Sure, sure,
so that we can have great discussions on the subject also. Thank
sure,
you.
sure. Yeah,
Uh,
thank you, sir.
now,
Thank you
now,
for the platform.
now it is up to Dr. Pallavi Chaturvedi.
Yes, sir. So thank you, IFPH. The work you all are doing is amazing and connecting homeopaths from all across pan India and globally. So, and I just hope that all the discussion, as they are saying, that it should not just be a discussion. It has to come into practical utility, and the effect should be seen at the college level, as we all desire, because this is our passion and the purpose of life, the mission of our life, as it was for Dr. Hahnemann. So we are all carrying his energies. The only one point I missed was that the drug proving trials which were done by our masters, and how they have made such huge materia medicas. I think all the students of homeopathy should undergo drug proving during their tenure, and they should be allowed to document their results and the methodology, so that they are more in tune with what the masters or what kind of work they have done. And in future also they will be encouraged to prove new remedies, and incorporate and contribute to the vast materia medica. So this is one thing that was missing in my college time, which I failed to understand how drug proving was done. I think practically it should be made to use, and
Okay.
rest all is done.
Exactly. That we will have to look into that area also.
Yes, thank you, Dr. Dhanesh.
Thank you. And now it's up to Dr. Shibashish Mukherjee.
Thank you. I would like to add that all the speakers have really highlighted a lots of key points, the key problem the students face, though the time was of limit, but a lots of problem has been highlighted by the different speakers and the co-speakers. So let's hope all the problems, the all what has surfaced from this discussion ultimately go to the policymakers. Just as Dr. Abhishek has highlighted, discussions will continue to go on, but for the real change, that suggestions should reach the policymakers. Because all the changes which we are we need a change in a much bigger scale, far beyond the individual scale or a scale of an organization, which requires involvement of or reach our voice to reach the authorities. So we are keeping our fingers crossed, and let's hope in near future we would see homeopathy in all its new glory.
Yes, exactly. Now it is up to Mr. Abhishek Singh.
And for the improvement, doctors.
Yes.
Thank you, sir. Basically, in the end, all we seek is clarity. Basically, clarity in practice, in purpose, and in path ahead. So we all know we are ready to work hard, stay true to our philosophy, and grow. But as a student, we all need guidance that connects learning with real life practice. So with the right support, and we can become confident homeopaths who heal with both heart and understanding. So in the end, I would like to thank everyone. So thank you all for listening, and my heartful gratitude for giving me this opportunity to speak today.
Thank you, Dr. Abhishek Singh. And now it is up to Dr. Sahani sir to say the conclude remarks, sir.
It was nice listening to this young students, I say, the young future of the homeopathy. That you have highlighted the things. Definitely our forum will be. No, since you may be knowing that I was the policymakers at the Central Council of Homeopathy and in the Education Department, all these issues were being under the process. But only part is that, like the Dr. Pallavi was talking about the repertory, I think, repertory from the beginning. I think Pallavi was talking. So definitely this course has been included in the new syllabus. Earlier it was only in the final year, and now it was added into the primary level. And my expectations is that the first day a student enter into the college, they should be allowed to be in the part of the OPD and IPD first. So first classroom should be the hospital, and the second classroom should be the IS. So this things has to be promoted, and the NCH is taking care of it. And new managements, they are also looking forward. It is only for the institutions to implement, as Pallavi was talking, the institutions, the corrupt practice, all these things everything will remain, but we have to raise the voice, keep raising so that the things will change. And thank you all participants for coming here and saying the nice voice suggestions to us. And definitely we'll look forward and meet you all together individually as well as collectively in the coming forums. Thank you all. And
Thank
with this,
you.
I think
Thank you, Sahani sir. And now
I just request if we can have seminars in our colleges where different doctors are invited, who are doing well and who have lot to
Dr.
teach.
Pallavi,
exactly.
So
That
I think more than online, if we can all meet offline and promote homeopathy among the students.
yes,
That
you,
would make more sense.
the request from us is that you people kindly subscribe the YouTube videos and share it with your friends and homeopathy lovers also, so that the purpose of this forum is to take homeopathy to every home around the world. Now I invite Dr. Shaji Kudia, the Vice President, to say a few words and vote of thanks to the session. Sir.
Yes, thank you. Thank you, Dr. Danesh. It was nice discussion today. I think it is good to have the discussions begins in the college itself, so we can understand their concerns and a few sharings from our side also. So I appreciate all the students and the people close to the students who come forward, inspire them to join our programs, and also whenever you get time while traveling, you should open our YouTube videos and watch it and listen to it, so that there are treasures of ideas of very doctors giving seminars, lectures, etc. Regarding the request about the conduct seminars, we are willing to do that, and please give invitations and can come over upon your invitation and give seminars, especially to explain the scientific side of it. That is main critical area we mainly dragging with. So with this, I thank you, and it is time to hand over for the Malayalam. So I am Dr. Shaji, the Vice President of IFPH, and keep in touch with me for any need, your concerns or any homeopathy. You are always welcome. We are open to anything, any kind of help needed from us. So please keep in touch with us. Thank you all.
Thank you, Dr. Shajit Kudiat, and thank you all. Once again, there is an announcement. As you all know, the fifth anniversary of IFPH is being celebrated on September 26th of this month, this year, September 28th of this year. Hope all of you will come over there in Cochin so that we can meet one by one, and we can have discussions on futuristic homeopathy. Thank you all. Good night. It's over to Dr. Mariamma John to